Hey, it's Dr. Thornell with New England Family Chiropractic. And have you ever had that experience when you go to stand up out of a chair, those first 5 to 10 steps, you're all hunched over and you sort of walk like an old man, and if you stand up too fast and you stand straight, it gives you terrible pain that might stay in your lower back or even shoot down into your leg. I want to show you today why that happens and a way to get around that, where you can get out of a chair and actually walk without having to shuffle for the first 10 steps. And part of the reason that happens, we look at a normal spine. If we were to face this direction, the lower back has a forward curve in it like that. And there is a muscle, very strong, thick muscle that's called the iliopsoas muscle that comes on the front side of your pelvis and actually attaches in the top part of your leg. It comes up through the anterior part of your pelvis and attaches up into the lower back. And when we sit, that muscle shortens. We sit down and the length here decreases, so the muscle shortens. Now, if that area is already irritated for some reason, that muscle will want to tighten in an effort to protect, so that we then try to go stand up, and that muscle that's now shortened doesn't allow us to stand right away, and it keeps us bent over for a little while until we work our way up again. Another reason that when people are injured, they're already hurting, and they go to stand up out of a chair, they tend to go forward like this and then walk up their legs, and your body won't let you stand quickly, because if we look at a normal spine here, if my disc space that's in between the vertebra here, protecting the nerve and the opening for the nerve on the backside here, if this is inflamed, and the inflammation as I go forward like that gets pushed backwards, now it's irritating the nerve, possibly the spinal cord, and if I straighten up right away, I'm going to jam that inflammation against the nerve. My body doesn't want to do that. My body's smart, and it says I need to protect those nerves. So as I bend forward, I'm pushing that inflammation back. I'm not going to be able to stand right up. It's going to be a slow process for me to stand. So the way that we want to do this instead, when I'm hurting already, those muscles are wanting to shorten, the inflammation's there, and I don't want to push it back, instead of going forward like this and then walking up your legs, the way to do this is to arch your low back forward the way you're supposed to have a low back anyway. Scoot right out to the edge of the chair or the couch or whatever you happen to be sitting on. Bring your feet underneath you so that they're not out in front like this. There's no way I can stand up if my feet are out in front. So I want to get my feet underneath me. I'm going to look up towards the ceiling, and with my belly forward, I'm going to stand straight up because I've already lengthened that muscle. So once I'm lengthened and I've got that inflammation forward, then I can stand and I'll be able to walk without any issue. So instead of bending forward and crawling up your legs and having those first 10 steps look like an old man, belly forward, scooch to the edge, feet underneath you, and stand straight up. Once we're up, we'll be able to walk just fine. So use that tip for getting out of a chair, and it'll help protect your low back in the long run.